A Lenexa lab is now testing for COVID-19 by using someone's saliva. The idea all started when an employee at the lab volunteered to use their own saliva after testing positive for COVID-19. 41 Action News reporter Jordan Betts shows us how this could change the game for testing.
Clinical Reference Laboratory is working around the clock.
It's been unprecedented, really.
Testing up to 6,000 saliva samples a day for COVID-19. There are 3 steps, taking 5 hours to complete.
In order to meet our scaling, we are pooling samples. So we are taking a little bit of each of 5 saliva samples and pooling them into one well.
Next, it's off to this machine.
We're purifying the virus out of the saliva. So as we talked about, it's really taking a needle out of a haystack there. We're purifying, taking all of the junk that's in the saliva, making it a very pure sample.
The most important and last step, testing for the coronavirus.
We're making lots of copies of the virus in order to identify it, and we're running that on a PCR instrument.
Once it's done, results are up. If one group comes up with a positive result, then a scientist will go back, grab those 5 saliva specimens and individually test them, results showing up as quickly as 14 hours.
It goes and sends a notification to the clients as well as the individual through our Clear app.
Scientists are testing kits from Kansas and Missouri, from universities like KU and Emporia State University. But now they are branching out, and they will do tests for the Los Angeles School District.
They just give you a little vial and tell you to spin in and fill up like that much or whatever.
Mather SALADIN is a KU student and says he would rather do this test than alternatives.
Pretty easy. I mean, I don't know what they could have done to make it any better.
But this isn't the only thing the lab is working on. They're hoping to have the ability to test saliva for COVID-19 and the flu at the same time by the end of the year.
One of the questions, if someone tests negative for COVID, they're like, well, what do I have? Do I have flu or what is it? So our hope is to create a multiplex test that can look at other infectious diseases in the sample and give a more complete picture for that patient.
And scientists say it's all about saving lives.
As a scientist, this is your dream, actually, to be able to help people. So it's been really rewarding, I know, for myself as well as our staff to be able to really make an impact here in a public health sense.
In Lenexa, Jordan Betts, 41 Action News.